Hi, I'm Dr. David Novatnak of Doctors Choice Physical Medicine and Rehabilitation in Pottsville, Pennsylvania. And one of the most common questions I get from any of my patients with back pain is, what's causing the pain? Well, they did a study to find out what's causing the pain. They took people who were having back pain, and the doctors wanted to find out what was causing the back pain. So this is kind of unbelievable, but these people actually volunteered for this. They took the people and they cut their back, so they cut their skin, and they would tie like fishing line to different structures in their back. So they pulled the skin away and tied the fishing line to the fascia that's right underneath the skin and yanked on it, and they would ask them, did that cause your pain? That didn't cause their pain. So they went down into the muscle structures, tied the fishing line around the muscle and yanked on it. That didn't cause their pain. They went to the muscle tendons, did the same thing. They went through all the structures in the lower back, and not until they got to the disc. The disc is between the two vertebrae, and they actually start to pull on the disc with that fishing line. The people say, yep, that's my pain. So about 97% of all back pain comes from the disc, and there's different ways the disc can cause pain. So typically what happens when you hurt your disc, and there's not much pain with it, because the way the disc is, the inside of the disc is more like a fluid material and doesn't have any nerve supply. The outside of that disc, more like the unfried portion of a donut, has very little nerve supply. So it's more like your fingernail. You can cut it, you know something's happening, but it doesn't really hurt you. But once the tear goes to the outside of the disc, and that's the thing of a tear going in your fingernail into the cuticle, ow, that's where all the pain nerves are. So a healthy disc looks like this. Here's the vertebra, here's the disc, here's the nerve that comes out. And it's pretty free, there's no problems with this. Typically, as you get hurt, the disc gets injured, and you might see a bit of a herniated disc. It might come up against the nerve a little bit. You can see the disc is all red and inflamed. If the injury is so severe, or else not treated right and keeps degenerating, we start to see something like this happen. So in here, you can see that the disc is thin, it's still inflamed, and we're starting to see bone spurs that are developed. It's not quite as clear as this anymore, as smooth. You're starting to get some ridging along the vertebra, and on x-ray it looks like a bone spur. So your doctor may say, oh, you have arthritis on your spine if you took an x-ray. When it really gets severe, there's hardly any disc left anymore, and the bone spurs are a lot worse. Another question that we get is, well, I didn't do anything, how could I have back pain? And if we would x-ray those people, they would look more like this. Okay? We can x-ray them, we'd see that their disc is thinner than it should be. We see some signs of degeneration, mainly the bone spurring. And what happens, everything's so weak in there, and the body's been compensating, and when it can't compensate no more, it hits the weak spot again, and you start hurting all over again. When these problems really get severe, we have things happen that we call a herniated disc. You might hear something like that, or a ruptured disc. And in this model, we have two vertebrae again with the disc. Now in this model, we can look right down in the disc. So in this model, the inside of the disc, called the nucleus, is blue. There's also some things in here that are pretty interesting. And there's a tear right here. If you see some redness right there, that's going around like an onion skin thing on the shape of the disc. That's called a circumferential tear. That's how the disc starts to weaken up. And then you got another tear that's coming down this way, right in this area, and that's a radial tear. And that's what really weakens the wall of the disc. It allows for the herniation. So here's the disc. You can see right back in here, there's a little bit of a tear that you can see. And when you put pressure onto that disc, you can see that the disc starts to herniate. And when that herniates really bad, it lodges right up against the nerve. Okay? So most of the time with the treatment that we can do, we can suck that disc back in off that nerve and start to repair this disc. Now the disc is never going to be brand new again. There's always going to be some damage there, but most of the time you can go through most of your life without much pain. So the answer is to your question, what causes back pain? 97% of the time it's the disc. So if you're interested in things like this and you're having back pain, there's another video that I have that's called the underlying causes of back pain. And at that point we get into some of the functions that would contribute to the degeneration of the disc. So if you have some more questions or would like an appointment, you can give us at Doctor's Choice Physical Medicine Rehab. The phone number is 570-622-2525.